Okay, and so just to sort of close that loop, and before we move over for a question to Rory, when would somebody seek help? And also, so it's a two-part question because somebody asked also, is it safe to go on, say, antidepressants if that's the decision at this time and living with IBD? And maybe this might be you and Dr. Benchamal that addresses this.
I'll let Dr. Benchamal address the medication thing. I'm a psychologist, not a psychiatrist, so I don't specialize in medication. I can't answer that question. When to consult? Look, I'm just going to be straight up and tell you I have a bias. It could never hurt to talk to a professional about what's happening on your mind. Even people that are well will benefit from talking through or writing out what we're experiencing. These are very unusual times. This routine has been disrupted. It's very disruptive for our nervous systems. One reason why one might not want to consult is if you can't afford it and you don't have insurance. But outside of that, and if you have time, outside of that, why not? If you want to get a full sort of mental health treatment, then it's another story. And again, if you're not able to recover to some kind of comfortable baseline with your mood or your anxiety or your stress, then certainly. But personally, I've just seen so many people from feeling very unwell to feeling perfectly well, but wanting to get more structure and meaning into their life, consult with a therapist. Again, that's my bias, so take it with a grain of salt.
I completely agree with Dr. Flanders. For our patients, you know, for me, pediatrician, but adult patients as well, I mean, the problem is not too much mental health care. The problem is not enough access to mental health care. So obviously the psychologists and psychiatrists are extremely busy right now, but I think if you can find one who you click with and who you connect with and who is available, I completely agree. If you're feeling that you're prone to anxiety or depression or other mental illness, it would be really important to get help. Like any other healthcare, if you're going to see a physician for your IBD, you should be seeing a mental health care provider for anxiety, depression, and other mental illness. As far as the question about medications, I think this is something that's been studied before, and really what we say now is that medications for mental health are safe to use in IBD. We know that in the best of times, people with Crohn's and colitis, and especially Crohn's disease, are more at risk for having anxiety and depression. And so we have lots of experience with, tailoring mental health medications with their IBD medications. And there doesn't seem to be any major interactions between the two, with very small exceptions. Speak to your physician, your IBD physician, about any possible interactions. But in general, we have lots of patients who are on these medications, and they are safe to use in IBD.